On Thursday, November 16th, roughly 10,000 Americans celebrated their 65th birthday. The same thing will happen Friday and Saturday and every day for the next 6 years. And by most accounts, the United States healthcare system is not prepared. 1 year in a nursing home could cost you $100,000. But 56% of adults said it would be impossible for them to afford that, according to a KFF survey. Lawmakers have tried to help with mixed results, or no results in some cases. In 2021, the Build Back Better Act included funding for home health care, but it never passed the Senate. In April, President Biden directed federal agencies to find ways to expand access to long-term care, but going beyond that requires an act of Congress. My next guest lays all of this out in an article for the New York Times. Let's bring in Reed Abelson. She is a healthcare reporter for the New York Times. Thank you so much for being here. For this piece, Medicare and Social Security, we're supposed to do something towards this. Why aren't they covering these costs?
Well, part of it is because we've changed. We are living longer, and Medicare is really focused on acute illnesses. It will help if you've fallen and need some short-term rehab. But the real problem is that there's no real solution for long-term care unless you're very poor.
And what sometimes happens, and I know this from personal experiences, is families will try to make the person poor enough to then be in Medicaid, which is for this kind of care.
Yes, that's true. But Medicaid often is only available if you need nursing home care. Yeah. And so many people want to be at home. Right. And so then you really have a challenge where you really have no options. And
nursing home care is really, you have to be at a certain stage of health to be in that. So
yes.
Let me ask you about help us understand the cost. So there's the cost of long-term care, those are going up, and then there's also a shortage of workers.
Right, especially in home care, but also in nursing homes. I mean, the truth is this is very difficult work. It doesn't pay a whole lot, and so there aren't enough workers. It's as simple as that.
And have there been legislative attempts to fix that problem?
Well, you mentioned, obviously, there was some attempt by the current administration to fund home care so that caregivers would be paid more, but that didn't go anywhere. It's really a matter of money and whether there's will to spend that money.
So that's the home health care piece. And again, the idea would be you have home health care so that you don't have to go into an institution and it meets up with people's wants, which is to be at home.
Right, exactly. The overwhelming majority really don't want to be in a nursing home.
What other kinds of fixes might there be out there that would address this problem?
So there are a few people, I mean, a minority of people have long-term care insurance, and that certainly helps. All of the government's attempts to try and replicate that system haven't worked. And so it's not clear whether, we can come up with a system where people could, in fact, pay into some sort of system so that they could then, draw on it when they needed it. And obviously there are people who think that Medicare should be changed
to incorporate this.
Yes.
Why haven't there been any legislative fixes other than, I mean, maybe it's just the normal sclerosis of Congress, but is there any particular trickiness with this issue?
I think it's really the money. I think it's very costly. And to be honest, there just hasn't been either the political and maybe even the cultural will to spend that kind of money.
Speaking of cultural will, a lot of this burden of long-term care falls on women. So is this a gender equality thing as well as a money thing?
Yes. Women, whether they're daughters, even granddaughters, are, either doing work part-time, sometimes leaving their jobs to care for their parents. And there have been studies that show that their income actually has really, their lifetime income has really been affected. So yes, this really is a burden on women, and one could argue that as long as women are stepping up, there's no political will to fix it.
So as a final question, if somebody's listening to this and they happen to be younger or concerned about this for themselves, what are the solutions that if legislation ain't coming?
Well, I do think saving money on your own is obviously important. But interestingly, it's also really important to talk about this with your family. I mean, I was stunned by how many people never discuss this until there's a crisis.
And having done it, those kinds of discussions, when there's a crisis, they don't go so well.
Yeah, exactly.
Reed Abelson, thank you so much for your work and for coming in.
Okay, thank you very much.